you say the importance, the priority is a critical factor in this. So let's go into that, because I think some people just say, just drain, just, do whatever you do. And that can go with even dry brushing I've seen. And, experts will say, no, there's not a any size fits all. You have to do it in certain ways. The body works in that way as well. So what is the significance of the steps within this that you'd recommend for lymphatic drainage?
Yeah, that's a great question. So, doing dry brushing and breathing and movement is great. At least you're doing something for the body, right? But once you understand how fluids move in the body, it changes everything, right? That's the biggest thing that I try to teach people. And that's based on the law of hydrodynamics. So I'm going to go a little bit of kind of the physics of how fluids move, one of the biggest properties of fluid. And it's this, right? High pressure fluids like to flow to low pressure fluids. That's just energy efficiency. Like high naturally goes to low because it's the easiest thing to do. Right? So imagine that you've got a water dam, okay? And then the water dam, you've got everything on one side and you've got nothing on the other side. If you open up the doorway for the dam, the water naturally goes to the low side, right? That's the way the lymphatic system works. So the lymphatic system goes from high pressure to low pressure. So where's the lowest pressure in the body in relationship to fluid flow? It's lowest pressure for lymph flow, and it's the lowest pressure for vein flow. And that's cool because the lymph flows into the veins at the lowest pressure site. The lowest pressure site in the body for fluid flow is the collarbone, both sides, right? Everything wants to go there. Now, if that's the lowest point, let's extrapolate out where the highest pressure points would be. The furthest distance away from the collarbone. Mm-hmm. Your fingers, your feet, and your head. That's why the fingers get swollen, the hands get swollen, in particular, the feet get swollen, because then you have to fight more gravity going all the way up, right? And it's trying to get there. That's what I'm telling you. It's trying to get to the low pressure side. But in order to get to that low pressure, it has to get past those lymph node clusters that we mentioned before. Now, if you have some type of obstruction or some type of blockage at your exit point where everything flows to, you're going to have an increase in pressure at the collarbone because it all can't flow out. Imagine a big pipe that has fluid in it, and I constrict the pipe 50%. Well, the fluid's got to go somewhere. If it can't go out, where does it go? It goes backwards. So when you close the collarbone down, and that happens a lot from tightness or tension and poor posture and poor breathing, all those sorts of things, then you backflow pressure to the furthest points. You get it in your brain, you get it in your feet, and everywhere else. And then they become stagnant because they can't get out, right? So when you do lymphatics, many people start dry brushing from the hands and the feet. And I don't want you to do that, because if you do that, you're bringing stuff from high pressure towards low pressure that might have blocks in it where it can't get out. So if you're blocked at the collarbone and you're sending stuff to it from your feet, well, it's just going to swell up because it can't get out. So you always go from low pressure towards high pressure. And in my world, it means this. You start from the collarbone with your work and you move up to the top of the head. You start from the collarbone and move down to your hands and then down to your feet. Once you do that, then you can work your way from feet and hands and head down. But you always go low to high first before you go from high to low, because it's just based on how fluids work. So remember, I told you before about the clusters, right?
Mm-hmm.
So let's give you an example. Let's say you've got swelling and inflammation in your right foot, or I've injured my right foot and I've got damage there because I sprained it. Well, you have what? Inflammation. Well, that's going to be your immune system. That's going to be lymphatics, right? So anything that's in that ankle that's been damaged, your body's going to try to get it out. And where's it got to send it? To your collarbone. That's where it's got to go, right? Particularly to the left side of your collarbone. That's where most of the lymphatics drain. But in order to get from your right foot to your collarbone, it's got to get past the lymph nodes in your right knee, the lymph nodes in your groin, the lymph nodes in your abdomen, and along your spine before it dumps into the left side of your neck. But that's just one pathway. Now, in order to heal that ankle, I need to get blood flow and nutrients and oxygen to the ankle. And then I'm going to ask you, where does that come from? Well, that comes from your heart, right? And then now the heart's got to send it down to the foot. But if you're blocked in the knee and the groin, in the abdomen, and in the collarbone, it can't even get there either because you're blocked both ways. So what that means in my world is you never treat the ankle first. Why? Because if stuff can't get out that I'm trying to treat it and I'm trying to bring stuff to it, my supply chain may be broken. So what we do is I always drain from the collarbone down to the ankle, then I treat the ankle. Does that make sense? Because that's a whole different ball game right there, right? Because now I want to ensure that my pipes work both ways. And because those nerves that sit there, nerves don't work well and they don't like it when they can't breathe and when they can't get oxygen and they can't get rid of the waste that they make from wiring and firing. So they're also the fish that sit in the toxic tank that you can irritate, right? But the only way you're going to know if those areas are blocked is to check them. And here's the cool thing. When you check them, you automatically clear them. How cool is that?
Yeah.
Right? And then along the way, I'm looking at your reaction to what I'm touching and what I'm clearing. Because I can promise you this: if I touch you in the abdomen and you jump off the table or you want to punch me in the face because it hurts when I push into your abdomen, I'm going to tell you that's going to be a deciding factor on whether your ankle gets better or not. Because that's where the choke point is for everything to and from your ankle.
Right. Because
your body automatically knows what it needs to do to heal itself. The question is, are you giving it the supplies it needs to do so, yes or no? And if your blood flow is compromised in or out and your lymph flow is compromised, I'm going to tell you it can't. And that's why stress is so important, because stress, incessant stress, increases tension in the body. And tension is tightness. And tight tissue doesn't accept fluid flow well. If you want to know what that feels like, make a fist for 5 minutes and let me know how your hand feels. Right? That's the same thing that's happening in all these areas, from tension and stress, from your job, from your relationship, from your forward posture, for how you think about yourself, all the stuff, 24/7, bam, 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 bam. Right? And then it can only take so much. And then when the body can't do it anymore, it tells you. It says, I need your help. I need you to change something. And what's the catalyst for change? I'm going to hurt you, is what I'm going to do. I'm going to cause pain. Not to punish you, but I'm trying to help you. And the biggest lesson I'm trying to teach you is, please don't look only at the site I'm sending you pain at. That's what it's trying to tell you. That's why you clear these lymph node channels first when I work with people, no matter what. Like, everybody clears these lymph channels no matter what your diagnosis is, because of, like I said before, with toxicity. Then we go back and we do all the other stuff. That's my number one benchmark of lymph comes first always. That's why. Does that make sense? That's a big concept that I want people to understand of. It's not just what you're doing, it's where you're doing it and the order that you're doing it in will make the difference on your results.
Yeah. I mean, it absolutely makes sense, especially for someone, I have a business background, understand economics pretty well, and supply chain management means so much. If you can't get something to somewhere, it doesn't matter. The demand doesn't really rush it. If you don't have it, it just simply won't work. So in this case, if you have pain and inflammation somewhere, which is a wonderful teacher of everything, but you cannot literally get the waste out, bring the oxygen nutrients in for the proper, you're in a losing game. So the whole idea is very, it's simplistic on the essence of it in a sense, because we all need to be moving things throughout the body, and the lymphatic system is that highway that does it. That seems to be, like Los Angeles on, during rush hour a lot of times in most of us.
Yeah.
And we are living in quite dirty aquariums.
Oh, everybody. Yeah. So I'm not saying that that's the only problem. And when you fix that, it's unicorns and rainbows. Sometimes it is. But what I am going to contend to you, it is such a big piece of your fundamental puzzle that if it's an issue and you don't take care of it, all the other things that you're doing, one, might not work, or here's the proverbial problem that everybody ends up with. Everything keeps coming back. That's something I've always wanted to know. Why in the heck am I doing all this stuff and stuff keeps coming back? Now, you're allowed to have more than one problem, but that one that I told you about, blood flow in and blood flow out and waste out, that's simple, but that's so fundamental that if it's not working right, you can't heal, period. Because that's the only way your cells get anything, man, is from blood flow. How the hell do you think it gets there? So it goes into the blood, but then it leaks from the blood and goes into what? The fish tank. And it goes into the fluid to get to the fish, to the cell. And then it goes back out. So it's the in and the out supply chain. Yeah. So it's not just a matter of blood flow getting to the fluid, but will the fluid allow it to cross over to get to the fish or not? Yeah. And if your lymphatic system is toxic and you're full of waste and you're full of excess protein because you can't break it down because you got a leaky gut, well, then you're not. Right? Yeah. So you do this in conjunction with everything else. This is what I'm trying to tell people is, do what you're already doing, but now add this to it. And then I want you to strap yourself in and watch what happens next. That's what I'm trying to tell you. Because when I show you how to release these places, people say the first thing they tell me is, "Doc, there's no way. Are you kidding me? That's it? That's all you got? It can't be that simple." And then I tell people, "Well, who the hell ever told you that? Why can't it be that simple? Effective things don't have to be complicated, right?
That's right.
It's just supply chain logistics 101.
Yeah.
Right? Here's the thing that happens. Yeah. When I did my lymphatic system, I got rid of 30 pounds of swelling and inflammation and body fat in 1 month. Because I got rid of the muck. Because when you're full of muck, which is my technical term for it, your body swells your container to try to dilute the muck. So you hold on to body fat, you hold on to swelling, inflammation, and edema, and you're like this, and you can't get rid of it.